And then also the temperature of the tissue affects it. You know, when you're doing some type of activity, where you talk about, well, you need to warm up, something like that. You know, with weather like this, you don't have as much of a warm-up period as necessary. But you know, in your places where it's snowing outside, your body's not going to get going as well unless you warm up a little bit first. In the same way that when you put heat on tissues, the collagen fibers are going to relax a little bit more. Your tissues are going to stretch a little bit more when they're warmed up. So if you don't have much flexibility or give in the joints, there's more likely for something to tear. Okay? And then, but if you have too much flexibility, then the joint's not going to be stable. It's going to be more sloppy. So you want to have kind of a balance between the two. You want stability, but you also want flexibility and motion. Okay? So different things, rehab programs people do to prevent injury is that you want your tissues to be able to lengthen and have mobility, but you also need to build strength. So stretching tissues can help build flexibility, which will decrease the chances of injury. And then in general, connective tissue is going to help hold things together. Right? Sometimes you have something that's types of connective tissue is more like loose, like the packing material of the body. It fills in different spaces, kind of holds things together. And in those situations, it's not very many cells. There's some fibers, but there's a lot of matrix. You know? Versus when you have dense connective tissue, then you have like things like tendons and ligaments, and those are going to be more of the actual fibers. And then, actually, I drew this here to explain. When they were talking about that person that's sliding down the cliff, and he said that he was able to fire more of his muscles than most people do. If you remember, when you talk about muscles, you have something that's called a motor unit. So a motor unit is one nerve fiber and how many muscle fibers it goes to. Okay? So, and then you can have certain muscles have a lot of motor units where you need a lot of fine control, like in the muscles that go to your fingers and hands. You need to do fine manipulation things versus in your legs, you just want, you know, to push. Okay, so then you may not have very many nerves. One nerve goes to a lot of different muscle fibers. Versus in here, the ratio is there's a lot less muscle fibers for each nerve. So what that person in the videos is a sympathetic nervous system triggered to fire all the motor units at once. So they were able to push more. And your body shouldn't normally do that because that's what happened is although he was able to push the rock up, it tore things that your body wasn't able to withstand because too many muscle fibers went at once. And because again, you have physiologic biomechanics and then pathologic forces. Physiologic forces like when those gymnast guys were jumping around and they're doing things that are sort of on the border of what normally you can do, but it's still normal physiology. They're just jumping and moving and stretching. But then you have other pathologic things where you have excessive force, where big slabs of rock are falling on you. And then you have the difference between sprains and strains, right? We talked about sprains occur to ligaments and strains occur to muscle. And then typically they're both given 3 different grades. You have grade 1, grade 2, grade 3. Grade 1 is where maybe the tissues are stretched, but they don't actually tear. They just come back to normal, so you don't really have any permanent damage. And that can apply to a strain or a sprain. Whereas 2, you're going to have usually about maybe 10 to anything less than 50% of tearing would be a grade 2. And then once you get to grade 3, you're talking about 50% or more. So in those cases where you get grade 2 or grade 3, you're going to have more swelling. The pain, though, if you tear the ligament or tendon all the way, then there's nerve endings aren't there anymore to perceive the pain. So somebody that has a complete rupture or a complete ligament tear may not have any pain, but they'll have swelling and they'll have instability in the joint, but they may not have pain.